Hello everyone, I'm Dr. Adam Clark. I'm the Director of Science and Policy here at the Lance Armstrong Foundation. My background is as a cancer biologist, and I oversee a lot of the science recommendations that come out of the foundation and that we relay to the general public. As you are all aware, this is Cervical Cancer Awareness Month, so we decided to reach out online to get questions from the public to see what some of the areas they were interested in learning more about so that we could help provide some of these answers. So I'm here to help address some of these questions, and my colleague Andy Miller is also going to be speaking with you about many of the other public health issues associated with cervical cancer. This leads into another question of what types of HPV cause cervical cancer. Really, there are several strains, but two of the most common are HPV-16 and HPV-18, which account for about those 70% of cervical cancers. We have vaccines right now that target some of these cancers, and some of these strains, and I'm gonna talk about those a little down the road. Another question was, how do you know if you have HPV? In reality, because there are so many strains, many of us will be affected at one time or another in our life. Many times we shed these viruses. Sometimes they will stay with us for several years, but in almost all these cases, they're very benign. However, the ones that are linked to cervical cancer are mainly identified after an abnormal result from a pap smear. So when should you get vaccinated? And right now the recommendations are to get vaccinated very early on, primarily before you start sexual activity. Health recommendations go down to girls actually at age 9. The reason is because at that point, for the most part, these girls are not sexually active. The drug itself, the HPV vaccine, is approved for women up to 26. There's been a big question as to whether or not boys should get vaccinated. Now, the reality is FDA has approved one of the HPV vaccines for boys at the same ages, 9 to 26. HPV is associated with certain cancers in boys and men, including penile, anal, and oral cancers. But it's also important to remember that boys and men are carriers of the virus. So by vaccinating the men, we in turn protect women from becoming infected with HPV. How often should you get vaccinated? The standard of care for delivery of the vaccine is 3 different vaccinations over a period of several months, and that is for both boys and girls. And subsequently, there were a lot of questions as to the safety of the vaccine, and I want to take some time to address this because this is a very important issue. The vaccine itself is safe, and we know that it is almost 100% effective in preventing infection by these strains of HPV. If you get it before, clearly you've been infected with the virus. It doesn't work to clear the virus after an infection has occurred. What happens many times in media are there reports of what we call adverse medical events from people who have been vaccinated. This happens in every clinical trial. Every adverse medical event has to be recorded. It doesn't necessarily mean, though, that the event is related to the actual injection of the drug. Sometimes there are, sometimes the events are not related. Many cases, people will just have an event to anything being injected into them. But the events that occurred with HPV are not necessarily associated with the vaccination itself. However, in cases of women who are pregnant, the recommendation is not to get vaccinated because the data are not clear as to whether or not there are risks to the fetus at that point. But as always, we recommend that you talk about these issues with your doctor, particularly if you are trying to become pregnant at this time. One of the additional questions that we received that we wanted to be sure to talk about was whether or not you still need to get your Pap tests if you have been cleared of HPV or if you've been given the vaccination. And it is very important to note that yes, you do. The recommendations for a Pap test are to start every 3 years, within 3 years of your first sexual activity, or at the age of 21. Since HPV itself is only associated with about 70% of these cervical cancers, that still means that there are 30% that we cannot prevent from the vaccination. The Pap test is a very good test to find cancerous lesions or precancerous lesions at the earliest stages and to medically intervene to prevent the development of further tumor growth. So for anyone out there who is hearing recommendations otherwise, or that the vaccine itself prevents 100% of cervical cancers, that information is false, and you need to continue with the appropriate recommendations for the Pap tests and under the guidance of your doctor.